If we're stripping carbohydrates makes such good scientific sense, why isn't everybody doing this? Some people may wonder, this is so different from the standard of care. Is this safe and effective for me? In the long term, believe it or not, many cultures in the world have eaten this way for centuries. One of them is the Maasai in Africa. And they were actually studied, and what did they find? They found that in these people their cardiovascular disease rates were incredibly low. Despite the fact that the majority of what they were eating was fat. Actually saturated fat, and their cholesterol levels, surprising to so many, were low as well. Another culture that's eaten this way is the Inuits. They've eaten a low-carb, high-fat diet for centuries. And again, what we find is an almost complete absence of type 2 diabetes and even incredibly low cancer rates. Let's look at the history of a ketogenic diet in the US. Remember, we didn't always have insulin and all these medications for diabetes. So what did we do to help people who have this disease before insulin injections became available? The father of diabetes treatment is considered Dr. Jocelyn. Dr. Jocelyn started treating patients with type 2 diabetes. Before we had insulin injections, and what was his treatment of choice? He treated people with a low-carbohydrate, high-fat diet. And an interesting thing is, one of the first people that he treated whose life he saved was his own mother. With this method, this is how we used to approach this disease. We got off track when we had so many medications that seemed like they might be easier, but we now have to go back and ask ourselves, are they, or did we know a lot back then? Something many people don't realize is that a ketogenic diet is used as a treatment for epilepsy in children. When medications either stop working or are no longer tolerated. This has actually been used for over 100 years. So the medical community deems this to be safe to be used in growing children. And a clinical study has looked at the growth and development of children treated with a ketogenic diet for epilepsy and have found that they grow and develop normally, so this approach is used even in children.